This is an overview of claims management and prognosis. To access the outstanding claim screen, you will be on the billing home screen and access the AR follow-up and outstanding screen. This screen is a compilation of every single claim within the system with at least a penny balance. Each claim is listed in order and in this grid, and you can search for particular items in this area. You can decide how this screen is sorted by up to 3 different ways. You can remove columns from this screen if you want to be able to see everything in a smaller grid. You can also from here access a lot of different information about the claim without having to actually click into the claim. For instance, you can see if the claim was accepted by the insurance company and if an EOB has been accepted. You can see billing notes that the clinic might have added to the system. You can see phone numbers for both the insurance company as well as the patient if it's loaded within the system. And you can also go directly to the encounter or to the patient's account screen. So you can do a tremendous amount without actually having to go into a claim. Another great feature of this screen is this filter button. This filter button gives you the ability to choose from some pre-configured filters such as aging that's less than 30 days old or workers' compensation or employer claims. These filters are automatically added in there for you, but you can also create your own filters. I have one that is set up to pull everything that is 120 days old or older with an insurance name like Blue. So when I pick that filter, it automatically filters everything by a payer called Blue. So anything with Blue in there, whether it's primary, secondary, tertiary, or patient responsibility. And here is the number of claims, the total charges, and my claim balance. From here, I can dump this to an Excel spreadsheet. I can select all of these claims and assign them to a staff member to actually work these claims. And I can give them a due date, give them some instructions. I can also go and create my own filters by clicking this button to add a new filter. And here are about 100 different options that I can utilize, categorized by different types of fields. So I can go down through here and pick as many of these as I want, set parameters within them, and then if I hit save as, it will save that new filter in my list, just like my 120 in Blue. From here, once I have assigned claims to be worked as tasks, I can go see the status of those claims. So going back to my AR follow-up route here, I choose the assign task screen, and that takes me to all of the claims that have tasks associated with them. And I can hit tasks list to see those specific claims in a report format. I can dump that to Excel. I can also do those same functions directly from here. When I go to my task list here, it's a very similar screen, but it has some additional information. So once I start documenting that I've done some things within my task, that information shows up on this screen, such as this little section right here, which says it was forwarded to the coder and there's a date there. So when I go into each task, I click my little hand here for my task, and here's who sent it to me, and here's the information that they sent to me. And then I'm able to pick from lots of different options. And this list of actions taken is customizable, so you can decide exactly what you need to have happen in here. So if I build it to secondary insurance, I can choose that, put some comments in, and then you can utilize multiple different statuses. So this is actually our status list that our revenue cycle management practices utilize. And there's a lot of choices here, but you can make this as simple or as complex as you would like. And then you can also set a date that it was completed or done and a follow-up date, or you can forward this to another staff member as necessary. Once you add this information and save it, it's then viewable on your screen here, which any of this can also be dumped to Excel, printed, and you can click here for a summary. There are also productivity reports that can be generated by the system, which will show you for your billing staff members how many tasks they worked, what the value of those tasks were, and multiple other things. And one other nice area for the staff member, as they're working these claims, they also have those same options at the top, including the button to create a medical necessity appeal. So this screen actually allows printing or faxing directly from here. And you can come in and pick a medical necessity letter. So you can have some standardized appeal letters in the system that can pull some information directly from the patient's chart, or you can add documents from their document list. So you can go in and add progress notes or pre-authorization notes, medical necessity information, and you can also include billing information. So if you need to send the original claim with it, or if there's been a payment and there's an EOB within the system, you can send that EOB directly to the payer or to the party that needs to receive the fax. And you can also type directly into this screen and make edits to it. And if that insurance company has a fax number loaded, you can come directly in here, pick the insurance company from the list of all of the contacts that are within the patient's register and hit go. And if they had a fax number loaded, that would show there. And then also here's the claims address that was utilized for the claims in case you need to print this and mail this. So all of that gets done. And then once you save it, it will save this in the patient's claim as well as within their patient account in the system. So you can see what was sent and when it was sent. And if you send it via fax, if the fax fails, you actually receive a message directly in your inbox to let you know that you have a failed fax message. So you can see immediately instead of having to wait to make sure that that fax goes through with the insurance company. Also from this screen, you can see the patient's insurance eligibility and information. Again, whether the claim was received by the insurance company. You can see all associated charges, payments, click directly right there and see the EOB. So you can see a wealth of information directly from this screen without having to leave here. And again, if you need to, you can go directly into the counter or the patient's account or leave a billing note for the front desk. So lots of tools to be able to work through these claims without having to jump around in the system a lot, get those claims worked, get those things appealed, and move on to the next task.